Namaskar, welcome to PK's classes. Today we will study chronopharmacology of lipid-lowering drugs. Chronopharmacology means when we study the effect of time of administration of drugs on pharmacokinetics or pharmacodynamics of a drug, that is called chronopharmacology. Chrono, time of administration, and pharmacology, pharmacokinetics and pharmacodynamics. So study of effect of time of administration on pharmacokinetics and pharmacodynamics of drugs. So when we say time of administration, that means we'll see those effects in our body which are undergoing circadian rhythm. Suppose lipids, so one is the synthesis or biosynthesis of cholesterol. Second is the absorption, the source from diet, then their absorption. And the third, the lipid metabolism in our body. Among them, the process which follows the circadian rhythm is the cholesterol biosynthesis. And accordingly, the drugs we can have cholesterol biosynthesis inhibitors, HMG-CoA reductase inhibitors or statins. Then the fibrates, which are the peroxisome proliferation activated receptor alpha agonists. They activate the lipoprotein lipase. Then the cholesterol absorption inhibitor, ezetimibe, and the bile acids which are required for emulsification of the cholesterol, that is the bile acid sequestrants, can also be used, like cholestyramine, cholestypol. Then lipolysis and triglyceride synthesis inhibitor, which also inhibits the VLDL secretion, nicotinic acid or niacin. In addition, we can have other drugs, the monoclonal antibodies we can use, the small interfering RNAs also we can use, the monoclonal antibodies like alirocumab, evolocumab. So among them, the statins are the first line drugs. Most commonly these statins are used, and the cholesterol biosynthesis occurs from acetyl coenzyme A, which is again produced from the TCA cycle. And when the cholesterol synthesis is inhibited, there will be upregulation of LDL receptors, and upregulation of LDL receptors will uptake the LDL, so that will decrease the LDL cholesterol. So in this way these statins act, and the cholesterol biosynthesis, if you see, it occurs more in the night than the day. And the peak of cholesterol biosynthesis occurs during midnight to 2 a.m. So since the biosynthesis of cholesterol mostly occurs during the night time, we should aim for treatment of the statins, which inhibit HMG-CoA reductase, which is required for the conversion of HMG-coenzyme A to mevalonic acid during the synthesis of cholesterol. So if we target the synthesis of cholesterol during the night time, then the drugs will be more effective than at other time like daytime. And this is a research study I want to show you, where you can see when there is no treatment, this we can see the timing in the midnight there is maximum, and this, if you see, 12 midnight to 2 a.m. there is this concentration of mevalonic acid is more, and we have seen that HMG coenzyme A reductase inhibition means mevalonic acid production is decreased, and normally this synthesis is more during the night time, and you can see 12:30 to 3 here in this study. So 12 midnight to 2 a.m. maximum synthesis occurs, peak of cholesterol biosynthesis is that time. And in another study, when statins were used in the evening, there is significant decrease in the cholesterol synthesis. By seeing this mevalonate concentration, it is observed that cholesterol biosynthesis is significantly decreased if the statins are used in the evening. So all these statins like lovastatin, simvastatin, pravastatin, pitavastatin, fluvastatin, atorvastatin, rosuvastatin, if you see the half-life, we can classify them into long-acting statins and short-acting statins. So these atorvastatin, pitavastatin, rosuvastatin, we can say them as the long-acting statins, and fluvastatin, lovastatin, then pravastatin, simvastatin, they can be called as the short-acting statins. So for long-acting statins, there is no chronotherapy relevance because their half-life is more than 12 hours. So chronotherapy relevance is only for short-acting statins like simvastatin, lovastatin, fluvastatin, and pravastatin, and for maximum efficacy they should be administered during the evening or at bedtime, because they can reduce the cholesterol biosynthesis maximum, because cholesterol biosynthesis occurs in the night, and particularly the peak is during midnight to 2 a.m. So this is all about the chronotherapy or chronopharmacology of lipid lowering drugs. Thank you.